the district has high levels of social disadvantage, large Aboriginal and Torres Strait Islander communities, and a large refugee population. In comparison with other people in New South Wales, our residents are less likely to exercise regularly or eat healthily, and are more likely to smoke and be overweight or obese. Adults, unfortunately, are less likely to take up immunisations, attend screening services, and when they become frail and aged, they're more likely to be hospitalised for falls. Therefore, the burden of chronic disease, which includes stroke, diabetes, asthma, cardiovascular disease and lung cancer, just to name a few, is higher in our district than in other places. In fact, about 80% of the population report that they have at least one of these diseases. These factors present us with a significant challenge if we continue to provide high-quality services into the future. And I'd like to share a personal conundrum with you. You'll be familiar with the concept of disruptive technologies. Such technologies are beginning to emerge in medicine. One of these is our capacity to sequence the human genome. That's the genes that make us all up and in many respects determine what happens to us. The first sequencing of the human genome, you'll be aware, took about 10 years and cost $2 billion. It's predicted in a few years that sequencing the genome will take about 5 minutes and cost $100. The consequence of this sort of technology will be groundbreaking, and we're beginning to see its effects. For the first time, diseases will be classified by their mechanisms rather than by their appearance or in which organ they occur, or in the case of mental conditions, how patients behave. Diabetes will no longer be just diabetes, it will be multiple diseases. There are probably 8 different breast cancers. Each will ultimately have its own treatment. We'll know the chemical changes in the brain that cause mental illness, and with luck we'll have treatments for each of them. Importantly, we'll also know which patients will respond to which drugs, and even more importantly, we'll know which patients will be harmed by which drugs. So the conundrum then is, given the burden of disease in our community, how are we going to meet the requirements of this exciting new era that many are calling personalised medicine? The short answer is, I have to admit, at the moment we don't know. But the district has given considerable attention to planning for the services to meet the demands of this new era. We'll certainly need to be nimble, we'll need to be flexible, and we will need to embed research into everything we do, and education into our service delivery, and to strengthen our partnerships with the other health providers in our district. We'll also need to work more closely with our patients, carers and community agencies. For those who need healthcare services, we'll be growing specialty centres of excellence and bringing them closer to the communities. It's entirely predictable that over the next few years, the emphasis in delivering healthcare will move much more to the community and, dare I say, away from the hospitals. We've also been focusing, when developing these plans, on strategies that will help people avoid ill health, including providing children with the best possible start in life, implementing the programs which close the health and life expectancy gap in Aboriginal communities, and building partnerships which address smoking, obesity, healthy eating, drinking and falls prevention. Over the last 12 months, we've consulted extensively through the district's well-established community participation networks and through contact with community and consumer groups, as well as government and non-government agencies with which we partner. All members of the community and district staff were also asked to comment on whether the proposed development directions met their needs, expectations and preferences for healthcare delivery in the future. Involving the community in this process is key to ensuring the district provides healthcare which is high quality, safe, effective, appropriate and available to all, regardless of where they enter the health system. And our community and consumer representatives, many of whom are here today, make a valuable and important contribution to how we deliver services and provide care. More than 500 individuals and organisations participated in these consultations, initial needs assessment and issues identification, and commented on the draft plans, either online or at the various community and staff forums. The end point of this comprehensive process is the district's strategic and healthcare service plan, strategic priorities in healthcare delivery to 2021. They're also accompanying it is the corporate plan for 2013 to 2017. You'll notice the shorter time frame, I guess, preempting the fact that things will change over the next few years. These strategies, or these plans, identify the strategies needed to achieve our vision of leading care, healthier communities. Sustained action across a broad range of fronts will be required to bring the vision to reality. Leading care in this new era will require a focus on quality improvement, safety, education, research, workforce development and training to embed best practice and excellence in healthier practice. Healthier communities will be achieved by placing patients and communities at the centre of care, providing holistic health that addresses social and subcultural contexts across the spectrum of prevention and care. Centres of excellence will adopt best practice healthcare, translating research into clinical practice. And of course, while advancing on a new front, we will not forsake the core values: collaboration, openness, respect and empowerment. But to these, we will add additional values: innovation and equity. Innovation will require a culture of inquiry and exploring new ways in service delivery with the understanding of the drivers and opportunity for future change. The district will support this culture through systematic evaluation of work practices, active encouragement of health research, rewarding workplace initiative and service redesign focused on solutions to local needs. All elements in the vision and mission in healthcare will be underpinned by a focus on equity, which will be at the forefront of how we design services and practice, with the aim of meeting the most disadvantaged, facilitating patient access to integrated networks of care, and optimising the flow of privacy-assured patient information between providers. A fundamental focus will be on building the capacity of communities to address health issues. The contents of the corporate and strategic plan are far-reaching, detailed and complex. Those of you on the staff will be expected to read it and answer multiple choice questions. Therefore, we've produced a summary of strategic directions, which you've been provided with in your packs today, and it is also available online. So that's the ready reckoner, if you like, and that's the one that's worth reading. This summary combines these two comprehensive documents and provides an overview of the actions the district will take over the next 5 to 10 years. The Chief Executive will outline for you the 8 priority strategic directions that have been identified in these plans and some of the actions that we've already taken since we met last year. In closing, I'd like to thank all of those of you who contributed to the development of these important strategic plans. This would not have been possible without the invaluable contribution of many of you here today. So it's given me a great pleasure to officially launch the district's strategic plan.